Dr. Sara Shane is a Pennsylvania licensed psychologist, a New Jersey psychology temporary permit holder, and a licensed professional counselor in New Jersey and Pennsylvania. She was awarded her doctoral degree in clinical psychology from Philadelphia College of Osteopathic Medicine with a specialty in cognitive behavioral therapy. She also holds a Master of Science degree in counseling from the University of Scranton. Dr. Shane has over 10 years of experience working in different settings of behavioral health care with individuals of all ages. She currently works at Neuroabilities within the neuropsychology department, providing neuropsychological assessment and CBT services to children, adolescents, and adults in the Pennsylvania and New Jersey locations. Please join me in welcoming Dr. Sara Shane.
Okay. Thank you so much for that intro, Andrea. And good afternoon, everyone. Thank you so much for joining this webinar. I'm going to be guiding you through, some different strategies you all could use, whether that's for yourself as adults or as parents, and also, things that you could maybe share with children and teenagers. Okay, so just a quick agenda. These are some of the items that I'm going to try to cover here in our time together. I just want to review. I know most of you probably are watching the news or reading articles, so I don't want to overdo anything that's out there on COVID-19 and the possible stressors it is causing families or individuals, but we'll just cover some of the basics there, maybe some quick facts about how these stresses are impacting our emotional well-being. I'll give you a brief introduction to cognitive behavioral therapy, and then we'll get started into some of the coping strategies that are all based in that cognitive behavioral therapy, or CBT. And then hopefully we'll save some time at the end and you could submit some questions and or comments. Okay, so the dull pandemic. I'm sure most of you are familiar with this picture. It's been all over the news for the past few months. When the COVID-19 pandemic really, I think, became an issue in end of February, early March, when it started really impacting a lot of lives across the world, and then especially in the United States, when we started seeing more numbers and numbers rising once the testing was available. And that kind of changed a lot of things in all of us, myself included. And, whether that was changing our daily schedule, our daily routines, affecting our employment status, increased stressors just within the family structure. Everybody's kind of quarantined in their homes and with each other 24/7. So that's causing a lot of distress for most people. And then in addition to some of the heavy hitters here, where, whether it's yourself that you were sick and showing symptoms of COVID-19, or you knew somebody who was sick and struggling, or even if you knew anybody that had lost their life to COVID-19. Some of these stressors are pretty heavy and are affecting all of us, like I said. On this next slide, here are some of the big heavy hitters, as I just discussed before. Everybody transitioning to remote learning or remote work. Those of us who have maybe lost jobs in certain areas of industry. I know that's, affecting everybody, and financial hardship as well. Maybe one person in the house is able to kind of work remotely and continue earning income, but maybe another one has lost their job and had to file for unemployment. The social isolation that comes with quarantining or even social distancing affects everybody of all ages. I know some of the children and teens that I work with, they were pretty much kind of excited to go on remote school because they could sleep in a little bit and they don't have to be in school for that 8-hour day. But now are starting to say they really miss being in the school environment, and some of them miss learning in that environment, and others miss the social aspect of seeing their friends all the time or even interacting with their teachers. And I think the same goes for adults as well. We look forward to those connections and interactions in places of employment, or even if we're just going out in the community and we are missing that. Like I said, the abrupt change to all our daily routines, being stuck at home 24/7, not being able to go out and do fun things, kind of dampens our mood and really changes our typical way of living. Missing important milestone events, that's been a big one too, kind of affecting, mostly I think about those college students who aren't able to graduate and walk. Also high school students, they're missing, the seniors missing a ton of different milestone events like prom and, any senior activities that I know in many high schools they have just for the seniors, and as well as their graduation. So that has to really impact them in an emotional way. And like I said, the big ones here, if you were dealing with sickness, grief, or loss of a loved one or somebody you knew, experiencing financial hardship, as well as job loss. Some of the coping strategies that I'm going to introduce later, might be more so dealing with mild to moderate adjustment to our new schedule and, remote learning and work, social isolation, changing in your routine, missing important events. Some of the other ones, if you are experiencing any of these, the last four here, that might be something where we might need to recommend, additional connections to professional services, whether that is just individual talk-based therapy, group therapies, things like that, to really kind of work through some of those that might not go away once COVID is relieved. All right, so as I call my webinar, the dull pandemic and keeping your sparkle. And what I mean is keeping your sparkle. I love sparkle, so that's why I'm adding this in. And, in work, people refer to me as Dr. Sparkles. I also refer to myself as Dr. Sparkles in my personal life, just for something fun. But, sparkle is just, what makes you, you, what brings you happiness. So all of those stressors that I mentioned about COVID-19, they have a negative impact on our well-being. They're increasing stress levels. They're increasing anxiety. And when I talk about anxiety here, I'm not talking about, clinical-based anxiety, more so that, we all experience levels of anxiety. And I'm going to get into that in the next slide, but, it's increasing those anxiety symptoms. It's decreasing our overall mood. It could worsen existing behavioral health clinical diagnoses. So, if those of you are suffering already from, generalized anxiety disorder or have a clinical depression diagnosis, it's going to make life a little bit more difficult too, and, worsen those already troublesome symptoms, as well as increased physical complaints. So we know, stress impacts our mental health, but it also impacts our physical health. So we could experience a lot of tension in our bodies, headaches, decreased sleep or insomnia, things like that. And it could impact just kind of our overall health. So, all right, so I wanted to make the distinction between stress, anxiety, and depressed mood just for this particular presentation. So stress is a response to something that's outside of our environment, right? It's caused by something, and then it goes away once the cause is no longer there, or once the situation has resolved. So, COVID pandemic happens, that's a stressor, and we are going to experience increased stress levels to that event. And once things are back to typical life, hopefully once we have a vaccine and things could go back 100% to quote unquote normal, then, our stress level should decrease with regard to that external cause. And stress, is just kind of a general sense of uneasiness. You're kind of feeling on edge, maybe. You have a lot of tension kind of in your body. Maybe you get headaches. Maybe you have, like I said, loss of sleep, or you can't sleep at all, which we call insomnia. It could wreak havoc on our physical bodies, so increasing our blood pressure, which isn't good. We can't be in a state of high anxiety, high stress all the time. And then just kind of worrying, thinking a lot about stuff, kind of maybe worst case scenario, or, what we call perseverating, meaning you keep kind of thinking about the same thing over and over. And that just can't be good. So all of that is what stress looks like. So if we move into what anxiety looks like, anxiety is a little bit different than stress. With anxiety, you have excessive worry. So, it's worry that doesn't just go away. Anxiety is also usually driven kind of internally within our bodies. A stressor could happen, that could cause anxiety. But when anxiety stays for longer periods of time, that's when we call it clinical anxiety. So yeah, you have excessive worry with anxiety, maybe a sense of dread that something bad will happen, increased tension kind of throughout your body, just always kind of muscles are clenched, you know, a lot of tightness, kind of feeling stiff. You could also feel restless and like kind of needing to move around a lot. You can't sit still. You know, a lot of people have, you know, leg bouncing, maybe they're biting their nails, maybe they're, you know, adjusting themselves constantly in their chair. Feeling completely overwhelmed. So that's not, I mean, we all feel overwhelmed when different things happen, but this is like a sense of like it's never going to end, of complete feeling overwhelmed. Other people have anxiety in a different form, like they get irritable, they have a short fuse, easily annoyed by others, they kind of snap at people. And then anxiety, as with all things, disrupts sleep and our eating patterns. So you could sleep more, sleep less, eat more, eat less, things like that. And depressed mood. So, you know, here, this is just, you know, you're feeling down, you're feeling blah, you're feeling sad. Maybe you have a decreased energy level or motivation to kind of get things done. You're procrastinating a lot on work or school. You have difficulty concentrating because your mind just kind of feels a little bit cloudy. Maybe you lost interest in things that you once enjoyed. So maybe you were, you know, into reading books, but you haven't been able to sit down because you're having difficulty concentrating or you're just not feeling it anymore. Or even, you know, physical activity. Maybe you were one who was, you know, going outside or going to the gym a lot, and now you can't, and you just don't really have the drive to do that. And then again, mood also impacts our sleeping and eating patterns. And depressed mood, you know, is a temporary type of state here that I'm talking about. So once a stressor is gone, you know, your mood should improve. If these things stay with you, become more severe, and also you start having additional symptoms, then we would call it clinical depression. So I just wanted to make kind of the distinction when I use the term stress, anxiety, and depressed mood in this presentation. These are the things that I'm hoping my strategies will help everyone who's on the call to, you know, practice in their own life so they could have some sort of sense of relief. Okay, so how do we keep your sparkle? Well, we got to be kind to our minds. Okay, so all of the strategies that I'm going to go over, you know, in these next slides here are all about changing the way you think about things, whether that's changing the way you think about yourself, about your life, about the world in general, about other people. You know, if you think different, you could feel different. And I'm going to show you how that works. Okay, so just a brief introduction to cognitive behavioral therapy, or CBT, as everybody in the professional world will refer to it as, but also you might see that if you're kind of Googling different things. But CBT is it's a talk-based therapy. It's short-term in that you're working towards different goals, learning strategies, and then with the hope of learning those strategies for basically the current time into the future. And the big takeaway from CBT is you're learning to understand the connection between your thoughts, your emotions, and behaviors. And when you understand that connection and you highlight it, then you could change the way that you think, which will then change how you feel and also change your behaviors. So the first introduction, you know, as I would be as a clinician if I'm working with somebody, I'm introducing them to what we call the cognitive triad. So the triad meaning there's a triangle connection between what you think, how you feel, and what you do. So, and like I said before, if we change one of these, hence why we have the circular pattern, they're all related to one another. So if we change one, we're going to change the other two. And where I like to start, I'm pretty heavy on the cognitive part, which is just the way you think. If you change the way you think about things, your perspective, the way you interpret situations that you encounter, then you're going to change how you feel in that moment and likely for the future, as well as your behaviors and what you do, the actions that you take. So keeping that in mind, the way we think, the way we feel, the way we act, or behave, they're all connected. So there's something called automatic thoughts in CBT that we refer to. So these are thoughts that kind of pop into your mind. They happen spontaneously, hence why they say automatic. And they're usually as a result of some sort of situation that happens. And, we would say they don't really arise from reasoning as much as they're emotionally driven. Okay, and they're hard to turn off. Sometimes we don't even recognize these. So if you were never even familiar with CBT, you might not even realize that there was a term called an automatic thought. And they're usually, I say negative and not helpful because they're not always negative, but they're definitely not always helpful to us. Okay, so how these arise is a stressful event happens. Then that leads to an automatic thought, something that pops into our head because of that situation. We don't question it at all. We accept it as true. And then that then leads to a negative emotion. Okay. So, the stressful event here could be, COVID pandemic happening. Automatic thoughts could be, what if I get sick? Or what if I lose my job? And then that's leading to, anxiety. That's leading to depression, depressed mood, frustration even. So that's kind of how the connection. So you have thoughts, feelings, and behaviors that are all connected to each other. One way to begin to recognize is that we have these things called automatic thoughts. As I describe these, to the adults listening, you guys are able to, I think, grasp that concept. For, little ones, children and teens, it might be a little bit harder, but, we as clinicians use different words. So sometimes for the little ones, I call these ants, A-N-T-S. So meaning that they're those little bugs that are in our minds that we can't get rid of. Other times I might refer to them as caterpillar thoughts, or, what the goal is to kind of change those to a more helpful thought, like a butterfly, things like that. Okay, now automatic thoughts fall into different categories. Now there are many different types of categories. They call them thinking errors. I'm going to go over some of the most popular ones, some of which maybe those of you listening have heard of. If not, it's helpful to understand what these are, because then once you have automatic thoughts and you start to recognize them, you could label them. And I'm going to show you why that's important. So there's something called the mental filter, which is you're focusing only on negatives and ignoring the positives in situations. So think of these as, you're wearing kind of a lens that's a negative lens. So you're just seeing everything negative, discounting the positives or completely ignoring them. This is usually something that happens when you are in a depressed state. You might have more of a mental filter because you're looking for things to kind of match how you feel in that moment. So those things that you're looking for are either sad things or tend to be negative things. Black and white thinking, this is also called all or nothing like thinking, is you're thinking only in extremes, in the extreme ends of things, rather than the areas of gray that are in between. So, one who is more into black and white thinking would think they're either faced with a situation, it's either right or wrong. It's never kind of in between, or they're a winner or a loser, never in between, or they, might be successful or a failure. They can never be anything in between. And that could cause some difficulty, if you might imagine, if you're thinking that way. Catastrophizing. So this is a big one I think that relates to our response to the COVID-19 pandemic, is you're expecting the worst will happen. So pandemic happens and you're already kind of thinking, this is never going to end, things are going to be like this forever, I'm not going to be able to deal with this, things like that. And then mind reading. So this is just when you assume you know what others are thinking. So, you're reading people's minds. That could get us into trouble, causing some issues if you are already thinking, what somebody is going to say or do based on absolutely nothing, just something that popped into your head. Some more common ones, judgments. So you're making a judgment or an evaluation on a situation rather than what you have the evidence to support. So again, you're just basing it on your own opinion, your own perspective without even questioning it or finding things that make it true. Shoulds or musts. So these are when you say statements like, I should be doing this, I must get this done. Thinking those in those ways, like if you're thinking I should, that puts unnecessary pressure on yourself and then sets yourself up for an unrealistic expectations that you might not be able to make. And it just, it doesn't bring you to a good place if you're always in that type of mindset. And then lastly, prediction. So you know what's going to happen in the future, again, without any evidence to support it. So you're making something based on just kind of what's popping into your head. Now, we all make these thinking errors. It's just some of us make them more often than others, or some of us are able to switch our mindset without maybe the help of a professional or the help of a self-help like book. But these things do occur for everyone. So what do we have to do about these? We have to understand the negative trap. So understanding the negative trap is understanding that we all have automatic thoughts that are usually rooted into these thinking errors, these categories, and that these thinking errors lead us to feel negative emotions and then also result in negative behaviors. So, if you're having the thinking error, like I mentioned before, of the mental filter, so you're only seeing the negatives, then you're going to stay in that negative state. You might stay depressed, frustrated, angry, even anxious. And then that's going to lead you to take action with different things that might not be, having your best interest, basically. So maybe you avoid things that make you anxious then, or maybe you yell because you're angry and you're yelling at others. So this thinking trap just really gets you kind of stuck in this negative cycle too, you could refer to it as, and we want to get you out of that. Okay, so how we do that is we have to learn to change our thought patterns or the way we think about things. One way to kind of do this, as I lay it out here, we have to define the situation. So like what's happening, then identify what we're thinking and feeling with regard to the situation that happened. Then we want to try to label our thinking error or thinking errors. Was this a mental filter? Was I catastrophizing? Was I, black and white thinking here? Then you want to try to view the situation in a different way using one of the strategies that we're going to go over soon. And then, lastly, then it would be you're replacing these automatic thoughts, these thinking errors, with a more realistic and helpful thought, which is going to, again, make you feel better and make you make better choices for yourself or your life. Okay, so one of the strategies I like is called the 3 C's. So this is how we're going to get out of these negative trap thought cycles. Okay, so firstly, it's all about self-awareness with CBT. So you got to understand that link between thoughts, feelings, and behaviors, because if you didn't understand that in the beginning, then you're not going to be able to catch any of these things that you're thinking. So you got to catch it first. You got to notice the negative thought or thoughts that you're having. Put a label on it. This is a mental filter. This is a black or white thinking. I'm just looking for the negative things. Okay, I'm catastrophizing. I'm making a prediction about something I have no evidence for. Then you got to check it. So is this accurate? You have to ask yourself, is this true? Where's the evidence to support why I'm thinking this way? Sometimes when you put that into perspective here, you start to question and be like, wow, okay, yeah, I'm thinking so negative right now, but there were some positive things. Or I'm thinking the worst case scenario, but that's not super realistic. What's more likely to happen here? And then you want to change it. So then you substitute a negative thought for a more realistic one. Okay, so the three C's: catch it, check it, change it. Just helpful little strategy to get you to think about things in a different way. So that's one strategy. And I think that could be helpful across the board, not only during COVID pandemic, but, to take with you for the future. And all of these strategies that I'm going over, I try to go over ones that are applicable to children, teens, and adults. I do work with all age groups, primarily right now, I do see a lot of children and teens. So, you have to bring in some of these strategies, at developmentally appropriate areas and levels, but I think all of these could be helpful to any person of any age. So if there are parents or even teachers on board on this webinar, this is something kind of quick and easy you could also help incorporate with your own children or your students. Next one, fact or opinion. So this is helpful to reframe some of these thinking errors or negative thought patterns that we might encounter. Okay, so facts, these are things you could find evidence to support it's true. They're also, you can't argue with facts. 2 + 2 is always going to be 4, okay? So you can't argue them. They're always true no matter what. And they're always kind of driven by a rational thought process, facts. It's like, your objective stance. What am I seeing? What am I hearing? What am I experiencing right now? Those are the facts. Now, opinions, these are based on our personal views or the way we interpret something. Now, these could also be arguable because not everybody's opinion is the same and not everybody sees the same situation the same way. And opinions are driven by emotion. So, they're hard to call rational all the time. I mean, you could have rational opinions. I'm not saying that, but, usually when you're driven by emotion, that kind of complicates things rather than focusing in on the facts. So how would you use this in a situation? Here's a situation. Someone you saw walked past you without saying hello. Okay, so that's just the situation that happened. Some automatic thoughts that might pop into your head, is they're ignoring me on purpose, or what did I do to them, or they don't like me. Now, these are all driven by our experience, right? However, if we stop and ask ourselves, once we catch ourselves doing these automatic thoughts or thinking this way, we have to be like, all right, what are the facts and what are the opinions here in this situation? So the only fact in this situation is the person walked past us, and everything else is our interpretation or is based in our opinion about the situation. Okay, so the only thing we know to be certain is that somebody walked past us and didn't say hello. Anything else we assign to that based on the things we're thinking or how we're interpreting their action is all stuff that's kind of in our own head. And it's helpful to recognize something like that because, if you're going with all these automatic thoughts and you're not kind of questioning whether this is based in fact or if this is somewhere based in opinion or the way you view it, then that's going to lead you to do certain things. So if you're thinking somebody's ignoring you on purpose, maybe you confront them and you're angry about it and you're frustrated and you're a little too assertive. Or even aggressive with them, or what did I do to them? Maybe that causes you to keep that kind of internal dialogue, and then maybe you avoid talking to that person and stop reaching out. Or if you think that they don't like you, that could also, whether you talk to them about it or you pull away, either of those options aren't helpful. But if you stopped yourself and said, okay, wait a minute, like, how do I know that person's ignoring me on purpose? I know nothing. Because they didn't say hello to me. Like maybe they were having a bad day. Maybe they didn't see me. Okay. So that just helps you reframe how you're thinking about a situation so you could handle it in a better way. The same goes to the other example I always use for this one is, you're driving and somebody, comes in front of you and a person could get very angry, start saying certain things out loud in the car, or thinking a certain thing about the person who came in front of you. But the fact is, the only thing that you know for certain is the person came in front of you. Everything else is kind of driven by how you're interpreting their actions, which might not always necessarily be true. So we got to be careful with that. Okay, another strategy is called the helicopter view. So here on the side is a helicopter pad. So when the helicopter's sitting right on the pad here, it can't see the H or the whole entire pad because it's too close. But as it, starts to go up and take off, they could start seeing the pad more clearly, a full view of it. So remember, when you're too close to a situation, you could have an obstructed view or a view that you just can't see it from a different angle. But if you zoom out from it, you're able to see the full thing. Okay, so what you got to do with the helicopter view is you have to ask yourself, what are you reacting to? So what's the situation that happened? Then you have to try to look at the situation from a different angle. You know, what would the situation look like in another person's shoes? Okay, so a person who's involved in that same situation with you, what might they see? You know, sometimes helping you step out of your own view and think of it from somebody else's is helpful to get you to get on the right track and out of that negative thought trap. Something else you might say is, what might someone else who's not involved in the situation say? You know, I use this a lot with children and teens. It's like, what might your parents say if they encounter this situation? Or, you know, a lot of, you know, my children and teens, they go to their grandparents, you know, the people that they, you know, go to who are wise and could give them great advice. And sometimes just thinking about that without going to that person could help you think about a situation differently, and then therefore you might act or feel differently. Okay, so next one, the 3 paths. So I like this one and I try to apply it to my own life as well. So you have 3 choices here, or 3 paths to take when you encounter a situation that's unpleasant or one that causes stress. So you could change something about your situation, okay? So you might ask yourself, is there something that I could change? Whether that's something you could change about yourself in the situation, like how you're thinking or your behavior, or is that something you could change about the environment you're in? You know, could you go someplace else? Could you move into a different room? Can you surround yourself with different people? Those are different changes that we're talking about here. And then if you're able to identify that you can change something about the situation, then you want to say, how can I make this change? You know, do I have all the resources I can to do this? Whether that's your own internal resources, you know, your emotional resources, or if you need to include other people in your support system to make the change. And then you want to just think about what's the first step you could take. You know, so sometimes just kind of thinking those things through could help lead you into a positive path. Sometimes we encounter situations and we're not able to make a change right away. So the next thing would be accept whatever the situation is for what it is. Asking yourself, what if I'm not able to change that right now? You know, that might be something too big to tackle. Or you might not have an answer or even a way about making a change. Maybe you don't have the resources. Maybe you're not ready to make that change. And that's okay. So then you stay in a place of just accepting something. And that's it. And then you might ask yourself, can I table this for now and come back to it later? You know, sometimes just doing that, it's like a lot of these things are outside my control and I don't know how to change it or what to do about it, but maybe I could just kind of let things be as they are and then kind of come back to it at a later date. Acceptance, I think, is an important path to choose, especially with regard to the COVID-19 pandemic, in that there's a lot of things that are completely outside our control and we aren't able to change. So accepting that as fact right now is that it's okay. There are some things that I'm not going to be able to control or change, and that's okay. But I can focus in on the things that I am able to change. Okay. And then lastly, sometimes you encounter situations, sometimes it's just better to just let it go, move on. You know, is this something that I could just move on from? It could be something that maybe you're catastrophizing, and as you take a step back and you're like, why am I thinking the worst case scenario? This isn't even a big deal at all. You might just be able to like, whatever, moving on, let it go. So you have 3 choices, 3 paths you could take to any situation: change it, accept it, let it go. Okay, so one way to, I guess, keep track of our thoughts and understand the negative traps we're in, and being able to maybe highlight the thinking errors that I was talking about before, or using any of the strategies that I just went over, the catch it, check it, change it, fact versus opinion, helicopter view, or change, accept, or let it go, is you could use something called a thought record. Now, I use this when I'm working with individuals in therapy, but you could also do it kind of as a self-help exercise at home. So here's an example of a thought record. It's pretty simple. Some of these could get pretty complex, and I wouldn't encourage you to do them without the help or aid of a clinician or professional. But this one's pretty self-explanatory, and I like to give it. All these worksheets and things like that I take from this website here on the bottom, which is a self-help website from the United Kingdom, and they're all kind of free worksheets that they give for the public domain. And I like a lot of their worksheets. A lot of them are based in cognitive behavioral therapy or CBT, and I just like some of the way that they're formatted and the way that they're worded. So I use them with children, teens, and adult clients. So here is a thought record. So what you do is you keep track of these things by writing things down. So what was going on around you? How were you feeling in that moment? What were you thinking? What did you do? Did that work? And then if it didn't work, what else could you have done? So for example, let's say you made a mistake at work on something, some sort of project. Maybe you said something you weren't supposed to, whatever it would be. That's the situation that happened. Then you ask yourself, what were you feeling in this situation? Maybe you were feeling embarrassed because you made this mistake in front of people, like your boss. Maybe you feel disappointed in yourself that this even happened, right? Because you never make mistakes and you somehow missed this one. Then you want to ask yourself, what were the automatic thoughts? What were the things that were popping into your head during this time? You know, some of them could be like, I'm a failure. My boss hates me. Everyone thinks I'm stupid. You know, so these obviously are automatic thoughts. These are not based in reality. These are things that your brain is telling you or your mind is telling you, and they might not be true. So if you didn't stop yourself, what you do with that situation, maybe you avoid talking to your boss or sending an email because you're like, I don't even want to have this conversation for them to highlight that I made this mistake. Or maybe, you know, you go home and you're sitting home and you're just focusing on all of the mistakes you've ever made at work and in your entire lifetime, kind of keeping you negative. So you want to say, if you did those things, did that work? Well, no, it didn't work. That's making you feel worse, making you feel more embarrassed, disappointed, if not leading to depression or anger, frustration. So what else could you have done if you went back to do your catch it, check it, change it? Maybe you were looking for fact or opinion. Maybe you were pulling back into a different perspective using the helicopter view. Might be, well, making a mistake doesn't necessarily mean I'm a failure, right? You know, making it more common. Like everybody makes mistakes sometimes, and they're not always done on purpose or intentional. And then maybe you might just highlight all the successes you had at work. So instead of focusing in on the negatives of all the mistakes you've ever made, maybe you try to retrain your brain to focus in on, all right, well, what have I been successful with? Things like that. So that's just an example of how one might fill out a thought record. So just stick to the facts here. What are the situations? Describe your feelings. So use feeling words like embarrassed, sad, happy, angry, frustrated, disappointed. What were you thinking? You know, I am statements, or, you know, this person thinks this. You know, these are usually rooted in how you feel about yourself, other people involved in the situation, or just kind of life in general. Think about what these thoughts make you do. Does it make you make a good choice? Does it work? Does it make you feel better? If not, then what could you have done different? Okay, so, you know, now we're kind of moving into some other different types of strategies besides the one that help you change the way you think about things. One of which is called self-monitoring. You increase your awareness of your own thoughts, feelings, and behaviors. And the more you know about yourself, then the better you can respond to a situation appropriately. So this is very helpful. So examples of self-monitoring are, you know, giving yourself a daily check-in, using a mood diary, which I'm going to talk about, journaling or writing in a diary, you know, keeping notes on your smartphone in the note folder, just kind of jotting down your thoughts, feelings, or using a thought record that I just showed you is kind of a way to check in with yourself, becoming more aware of how you're thinking and feeling and how it relates to your behaviors. So a daily check-in, one I like to call it checking your battery life. So we all kind of think about batteries, you know, our phone battery, you know, whether or not we're charged or we need charging. So if you have a daily check-in with asking yourself like how you're feeling and why, that could be helpful then for you to make a choice of what to do next. So you might think of, rating yourself daily, like 0 to 100% charged. And charged could mean like you have a lot of energy, you're feeling great maybe, or 0 meaning you have 0 energy, or you're feeling, sad, depressed, whatever it is. Or you could think about it in, more of these terms, like you have no charge. Shut down means like you need to go completely off the grid for a little bit. Maybe you just need a brief charge, like doing something like eating a snack or talking to a friend to kind of boost your mood a little bit. Or maybe you need to have a full charge, or you are fully charged, so you have a lot of energy, you're feeling great, just kind of a little way to check in with yourself. I like this other one here, HALT, or HALT, sometimes asking yourself these questions. Are you hungry? Are you angry? Are you lonely? Are you tired? So some of those things, when we're hungry, when we're angry, lonely, and tired, they drain our batteries. So if we could address any one of those, we could boost our battery and get us back up to the charge we need. Some families that I work with, they maybe don't do a checking in with their battery, but a daily check-in with the kids kind of at nighttime, thinking about the highs and lows of their day. That could be helpful for adults too, just kind of reflecting back on your day and, how you were feeling, what was great about it, what was not so great about it, could help you learn more about yourself and why you feel the way you do. A mood diary. So again, this is from that self-help website. I give this to children, teens, and adults. Very helpful. Days of the week, Monday through Sunday. And you have a what we call a Likert scale rating from 1 to 10, where 10, you're feeling great, 5 or 6 is kind of in that middle meh, and 1 is you're feeling, it could be sad, it could be having a bad day, feeling down, anxious. And then on the side, you would jot down what were the good things that happened today, what were the bad things that happened today. Just helps you know where you are. You do this at the end of your day, reflecting back, maybe after dinner, before bed. You could do this in your head. You could print something like this out and do it, handwriting. You could also use apps. They have plenty of apps if you just search on, a smartphone or on your tablets for a mood diary. They have ones where you could just click little emoticon faces about how you're feeling, or also even selecting a rating. So I just think it's helpful. I like to give these, as kind of the start of working with somebody, just because not everybody does that self-monitoring piece and checking in with themselves enough. Mindfulness is another area of a strategy, is where you're just kind of focusing in on the present moment, and you're just becoming more aware of where you are and what you're doing. So you're paying attention on purpose. And you're not reacting to what's going on in your mind or becoming overwhelmed. You're just kind of staying in the moment and focusing on what you do. So one simple thing to be mindful and stay in the moment is something, I like this little illustration, the high five breathing. Sometimes I call it the starfish, which is basically you trace your finger with your other hand all the way around. And as you go in one direction, you're kind of inhaling a deep breath. And as you trace back out, you exhale. So breathing helps you stay in the moment, because if you're focusing on doing the tracing, you're not really up in your head kind of thinking about things. And if you are, you could keep kind of bringing your attention back to this little exercise. The stop sign is another way to stay in the moment, which is mean you encounter a situation, you want to stop for a minute, count 1 to 10, give yourself some time. Take 4 deep breaths. This doesn't have to be super complicated. All you want to do is inhale deeply through your nose, hold that for 2 seconds, then exhale through your mouth. And then lastly, maybe say something positive to yourself, like this will pass, I could do it. Very helpful. Children, teens, and adults could use this, just getting you to kind of reset. A mindful activity would be choosing an activity to do mindfully throughout the day. You want to stay in the moment and ask yourself what you see, hear, smell, or feel. Just notice where your mind wanders. Don't pay attention to what's going on there, and then refocus back onto your chosen mindful activity. And describe it rather than judge it, and be patient with yourself while you're doing this. So up here I have a picture of a guy doing dishes. You could do a mindful based activity by just focusing in on doing the dishes. What's the temperature of the water? How does it feel on your hands? Just focusing in on the steps of the actual activity to keep you in the moment, out of your mind, worrying, focusing on the negative. Some people also do this if they're like cleaning or vacuuming. I had a philosophy professor in college who said she was really into Buddhism and meditation, but she said that she liked to be mindful when she was vacuuming her house. So whatever activity it is, you just pay attention fully to that activity. And that's helpful to kind of get out of your mind. And then lastly of these, using your senses, kind of just naming 5 things you see, 4 things you hear, 3 things you feel or touch, 2 things you could smell or like the smell of, and then lastly, taking a slow, deep breath. So that's also just a quick and easy one to get your mind off of whatever you're thinking about or whatever's causing you worry. Some of these other things, so I know we're going to be wrapping up in a few minutes, so I'm going to go through these a little bit quicker, but I think you'll still get the drift here of what I'm saying. Positive affirmations are positive statements you say to yourself and you highlight your positive qualities. The belief is if you think positive, then you will be positive. So if you say something to yourself, you might not necessarily believe it to be true, but if you say it enough and dedicate time doing it every day, whether it's writing it on a Post-it and hanging it on a mirror, reading it on a piece of paper that you have, or you type it out, or having, some of those apps could actually send you affirmation statements kind of automatically through a text message or a virtual message every day. But, you say these to yourself every day to keep you kind of grounded into you are a good person, you're doing the best you can, and you want to remind yourself that. So, some examples: I'm doing my best. Today is going to be a great day. I choose to be happy today. Another way to kind of reframe those negative thoughts into focusing in on positive. During COVID pandemic, it's important to have social support. Maintain your social connections with your family and friends, even during this quarantine time or even social distancing. You want to stay connected through, any means necessary. It's really great in this, day and age. We have so many accesses to all different types of ways to communicate, phone calls, texting, video chats, Zoom meetings that are all over the place now, social media accounts. Regular contact with your social connections, they decrease feeling isolated because you're, commiserating with other people who are in the same boat and feeling the same way. And then you can provide support to one another. And it also improves your mood. Just caution you, don't overdo it though. Don't overschedule yourself, with meetings and virtual chats and things like that. Just maintain a balance. It's all about the balance. Also, I'm sure you've heard all of these, limit your access to the news coverage. Dedicate maybe a specific time that you read the news on your phones, or you're reading articles, or you're watching TV. Just dedicate that time and stick to that time. Too much information can be very overwhelming. It could start to make you catastrophize and think a lot of different things. So if you limit it, then you'll be good, because it's always good to stay informed. We just don't want to overdo it. And then, establishing daily or weekly schedules. I know a lot of families are doing this, setting time for the school or for meal time, for, keeping on a good sleep schedule would be nice, going to bed early or at the same time every night, waking at the same time, keeping some sense of normalcy for yourself, engaging in some physical activity or exercise, going for a walk. I know a lot of the gyms are closed, so if you were in the gym, maybe doing some stuff at home, watching videos, workout videos, doing things like that would be helpful. Keeping consistent meal times, dinner, breakfast, lunch, engaging in self-care routines. So, whatever it is that you like to do, whether it is you like to read social media, or you like knitting, or you like binge watching Netflix shows, or you like to read, whatever it is, make sure you're taking care of yourself and doing that. And then, limiting news, we also want to limit our screen time and social media, because that could also be, a reason we get headaches and, our eyes hurt us. So, keeping ourselves to times when we look at that media could also be helpful. Okay, so lastly, don't let COVID dull your sparkle. Try to practice some of these strategies or thinking about things different to help you. And I will open it up to some questions. And here are some information about Neurabilities Healthcare. Check us out at neurabilities.com. You could also email at us at info@neurabilities.com or reach us at 856-346-0005. And just know we are taking telehealth appointments for many of our services and taking, safety protocols when we do see people in office. And I'll turn it over to Andrea for some questions.
Thanks so much, Dr. Shane. Yes, look at your screen right now. Please make sure you jot down their website, email address, and their phone number for Neurabilities. They're a great resource for you to tap into. Explore their website to see what else they have to offer. We're getting some great feedback, Dr. Shane. No questions yet, but a lot of people just saying excellent presentation, excellent, excellent, excellent. And I felt like you were talking to me specifically throughout the whole presentation. So I was definitely here taking notes. I think this applies to everyone and super helpful. So if anybody has any questions at this point, type them into your question section of your toolbar and I'll be able to read it aloud. And obviously nothing too specific to the situation that you're in or the situation that your child is in. General questions, because obviously Dr. Shane does not know you all specifically.
Exactly. And I just want to say, if anybody, on the call, whether it's themselves or they're thinking of their children, that they feel that, cognitive behavioral therapy approach might be, the best fit for them. I encourage you to, find a provider that practices cognitive behavioral therapy. There's plenty of us out there. One website would be psychologytoday.com. You could, Google providers that are near your zip code, and you could actually select on like their little menu bar, people who practice cognitive behavioral therapy.
Okay, one question we did receive, is there a specific minimum age in which CBT is most useful? Typically developing child versus a child with ADHD.
Yeah, so, for my practice, I like to stick with the age like 7 or 8. It does kind of depend on how well the child could grasp the concept of understanding the connection between thoughts and behaviors and feelings. But, I find that 7 and 8 age range is kind of the best bet to kind of start some of the stuff. That doesn't necessarily mean you can't do, maybe an altered form or adapted form of CBT for other individuals that maybe are younger. It just might look a little bit different. But you could still teach them some basic, strategies that might not be so much about the cognitive piece until they're ready for that age to transition into that piece. But it could be more of the behavioral piece. That stop sign exercise could kind of work for any age, really.
Okay, great. Another question we have is there a mindfulness app or affirmation app that you know of that is appropriate for teenagers with Asperger's?
Well, the one that I kind of recommend a lot is the Calm app. You might have seen that advertised. I know I see it all the time on my social media. So it's CALM. It promotes sleep and well-being, but it has kind of the affirmations and mindfulness. And I think that would be appropriate for, any developmental level or age. And I think that there's another one called Breathe, which is BREETHE, Breathe. That's very similar to that. It could kind of set you up with doing some positive affirmations or mindfulness-based activities.
And from personal experience, I know that on Sirius XM, they're actually doing having a free Calm radio station. So it goes along with the app. So they're offering that free during this time. So there's like mindfulness music and affirmation. So it's a great something to have in the background during homeschooling or during the day.
Yeah, I love that.
Yeah, I as you can tell, I definitely learned a lot from this.
Good, I'm happy.
That's all the questions we have for now. And it's amazing, Dr. Shane. I really have gotten a lot of feedback. Everybody, excellent presentation. Thank you so much. Everybody's super excited. So everyone, we did record this webinar and it will be on the Family Resource Network website, along with other past webinars we have. You can view those. Any closing remarks you want to make, Dr. Shane?
No, I just want to thank everybody for tuning in, taking time out of the day to log in, and I hope it was helpful. I tried to cover as much as I could to give people access to strategies if they weren't able to access them via a professional on their own. But I think these are all helpful to use, and good luck, and I hope everybody practices them and stay safe and wash your hands.
Wonderful. Thank you so much, Dr. Shane, and thank you to everyone.
Thank you.